Hello and welcome. I'm Kate Alexandra, and this is a yoga sequence that's designed to create a greater sense of gentle movement, gentle stretching, and freedom in the lower back. So when I'm talking about the lower back, we're talking about the lumbar vertebrae, the spine, the lower portion of the spine, and the point at which it intersects with the pelvis. So the sacrum, the triangle-shaped bone at the back of the pelvis, and the two joints that connect the pelvis to the sacrum, which are the sacroiliac joints. So if you've recently given birth, or if you're in a year or so postpartum, you may find that those joints are still a little soft or maybe even displaced from the pressure of pregnancy. If you are experiencing quite extreme discomfort or pain, this is really not a great practice for you today. It's really for those who are maybe just wanting to be careful of their lower back, wanting to encourage really gentle movement and starting to rebuild a little bit of strength, and you don't feel like throwing yourself into a full vinyasa class. So listen to your body. Your body will give you very clear signs if you're moving into that discomfort, pain area. Yoga is not a one-size-fits-all practice, so really do listen to your body and the messages that your body is giving you as we practice today. So to begin, a couple of props. I've just got a pillow from my bed, and a blanket, and I put the blanket down because when you've got a bit of a sore back, it's kind of nice to lie on a really soft surface. And then I've got a couple of yoga mats underneath that as well. So go ahead and grab yourself some cushions. So this one is mainly to support underneath the legs when we come to Shavasana. It's really nice to have support under the knees to allow the lower back to be a little bit more relaxed when we're resting in Shavasana. So that's what that pillow is for. So if you've got a bed pillow or a couple of couch cushions, that'll be fine. And any sort of thick blanket or towel will be good. So go ahead, lie down on your back. You don't need your pillow just yet, so you can pop that off to the side. And lie down on your back with your knees bent, soles of the feet on the earth, and bring your hands to either side of the body. And starting to draw your focus inward, arriving here with your body on the mat. And noticing the sensations that are present in your body. We're starting to move from the world of thinking and doing to feeling and being. Bringing your attention to your lower back, that area of the lumbar vertebrae, the sacrum, pelvis, bringing your attention there, and letting this part of your body know that you're listening. I am listening. You can speak these words silently to that area of your body that has been communicating with you. There's some discomfort, or it's just a tender area that needs a little bit more gentleness and awareness. Feeling into the sensations on the right and left hip, the right and left side of the pelvis. Really tuning in to where there's that sense of tenderness in your body. Wanting to offer our body great care as we practice ease, sukha, in our practice today. And then picking up the feet, drawing the knees into the belly, holding on to the shins. And as you inhale, draw the knees away from you. And as you exhale, squeezing the knees in, just as much as feels comfortable for your lower spine. Inhale, straightening the arms, legs move away. And exhale, drawing the knees in. Just moving in this way for a few more breaths. Just gently moving, starting to mobilize and stretch this area of the lumbar spine. And then bringing the feet back to the mat. Bring the heels quite close to the buttocks and pressing the hands against the femur bones, the thigh bones. We're going to take an inhalation. And as you exhale, draw the belly button towards the spine. So you're activating your core muscles here. Inhale, full belly breath. Exhale, drawing the belly button towards the spine. So there's a contraction through your abdominals. Now adding on to that with your hands on your thigh bones as you inhale. Exhale, press the thigh bones away as you draw the belly button towards the spine. Inhale, release, full breath. Exhale, pressing the heels of the hands against the thighs. Releasing and inhale. Exhale, pressing them away. So as you're moving here, you'll notice that you're able to support the lumbar spine by contracting the core, so there's some strength and activation in the belly. And we're aiming for getting a little bit of a release through the lumbar vertebrae and the sacrum as we press the thighs away. So there's a bit of lengthening, stretching, but with support from the core. And release. Stretching the legs out long on the mat now. If that's quite uncomfortable for your lower back, you can bring the knees bent. And just noticing the effects of the practice thus far. Tuning into the lower spine. And as you exhale, mindfully releasing any peripheral tension that you can with this sense of letting go on the out-breath. And as you're observing any changes that may have taken place, try to do so without judgment. We're going to do a little exercise now that is working on the sacroiliac joints at the back of the pelvis. So we're going to do one leg at a time. Take the right leg up. You can keep the left leg bent. Otherwise, maybe straightening out on the mat feels okay. Otherwise, sole of the foot on the floor. Similar to what we did with that first exercise, but just with one leg at a time now. Inhale, arms lengthen away. And as you exhale, squeeze the knee towards your belly. And as you do this, see if you can keep the ankle in line with the thigh so that your foot's not swinging in or swinging out. You're trying to keep the lower leg parallel on the same plane as the upper thigh bone. Mindfully moving with breath. And release. Noticing any difference between the right and left side now. Taking a moment to check in before moving to the other leg. Try to keep the right leg as you had it on the other side. So if you had it straight, do that. Otherwise, keeping it bent. Keeping the foot in line with the thigh, so not swinging in or out. Inhale, straighten the arms. Exhale, squeezing the knee down towards the belly. So with this exercise, keeping it at a place where you feel a sense of ease, so not pulling into discomfort or not forcing. We're trying to gently encourage the sacroiliac joint to find its natural home. If it's a little bit out, maybe from the relaxin in pregnancy, you may still be suffering postpartum from an uneven pelvis. This gently coaxes it back in. Last one. So bringing the soles of the feet back to the mat, or maybe both legs out straight and checking in. And from here, we're going to take some really gentle pelvic rocking movements. So coming back to working symmetrically, just rocking back and forth. So tipping the tailbone up and then tucking it under. Just finding your range of movement again, not pushing right to your edge. We're aiming for a sense of ease here, gentle mobility, and then coming to stillness again. Bringing your awareness to your lower back and speaking silently, I am listening. Listening with your full attention to what's happening in that lower back region. And then very slowly rolling to your side and making your way up. We're going to take a more active posture now, downward facing dog. So bringing the hands to the mat. Actually, first we'll do a little bit of work on all fours before we come all the way up to the dog. So inhale to drop the belly, bring the gaze forward. And then exhale, flattening the spine and sinking the hips back towards the heels. So coming to like a half child's pose. Inhale, coming forward, moving the chest towards the front. Exhale, straightening the spine, drawing the belly button in and just sinking the hips back. Moving really slowly here, noticing if you hit a pain point or area of tension or resistance, and respect that limit that your body is expressing to you. Really feeling what's happening at the back of the sacrum, noticing is there symmetry, or does one side of the pelvis like to move a little bit more than the other? And finishing that last round that you're on, we're going to come to downward facing dog now, tucking the toes under, sending the hips up and back. Palms are spread flat to the earth. Fingers spread and really pressing down through the index finger knuckle. By doing that, we're encouraging the whole palm of the hand to press to the earth, and we're engaging the muscles of the forearms to better support our structure here.
Gentle activation of the lower belly, so drawing the rib crests in, drawing the belly button in, creating length on the underside of the torso, the belly side of the torso. And imagining the thigh bones are spiraling back, inwards. And as you imagine that the thigh bones are starting to spiral inwards, making sure that it still feels as if the shin bones are pointing laser sharp forward so they don't roll with the inner thighs. Outer hips, outer buttocks press up and back, spreading the sits bones towards the back wall. Rib crests in, length on the underside of the body. Just here for a few more moments, bringing your attention now, once you've found your alignment, bringing your attention to your lower back. Noticing what's happening in that part of the body. And with ease and mindfulness now, coming back down to the mat. And just sitting back on your heels, just taking a moment to check in. So that was quite a long, strong hold in downward dog. But by creating length on the front side of the body, activating the belly, drawing the ribs in, we're creating support. Because downward dog is still a forward bend, which can stretch that part of the body. But we want to do it with support. Coming down onto your belly now. We're going to take some very I was going to say some gentle movements, but it really depends on what's going on in your body. So if you find that as we do this sequence, it feels like too much, you can go back to the cat and the modified child. So bringing the forehead to the mat, and bringing your hands to either side. We're going to come up into baby cobra, but we're going to do it with a breath that's a bit different, perhaps, to what you're used to. We're going to take an inhalation on the ground. And as you exhale, draw your belly button to your spine, so you're contracting your abdominals and lifting up on the exhalation. Inhale, drop back to the earth. Exhale, drawing the belly button in, lifting up. Now, if this is in any way feeling sharp in your lower back area, just go back to that gentle cat and modified child. Last round. Remembering to lift on the exhalation, drawing the belly in. And then pressing yourself back to child's pose. Now, if you find that child's pose is really strong for that lower back area, you can just take the modified child, so coming as far back as feels comfortable. You may wish to make a little pillow for your forehead, stack your hands. And from this posture, bringing your awareness to the back of your sacrum. And imagining that you could extend your breath to that area of your body as you inhale. Imagine extending right down so your lower back would expand with that in-breath. And exhale, softening all of the muscles that have maybe been a bit tight or in a state of excessive strain. Slowly coming up to all fours. We're going to take it to downward facing dog one more time. So we're working here with a bit of duration. Getting a long, strong and supported stretch for the low back. Reaching the tailbone towards the sky. Spiraling the inner thighs inward and back. Shins forward, hips back, sits bones spread. Giving your body the gift of your attention, your awareness. Getting to know the areas of your body. Listening deeply for what they're trying to communicate when they're experiencing discomfort or tension. Making an agreement with your body to be on its side. Be on the side of your biology and listen to the messages your body gives you. Very slowly now, coming out of that downward facing dog.
We're going to take a seated pose before we finish up now, Baddha Konasana. So soles of the feet together, knees wide apart. And trying to line up the soles of your feet, finding a sense of symmetry here, or noticing where there is asymmetry. One side may be a lot tighter than the other. And slowly folding forward here, just finding your edge, your place where your body would like to pause. So we're getting into releasing the muscles through the inner groin, the inner thighs. So just finding a place where you can be at ease with the sensation and bring your attention to the areas that are communicating with you. And seeing if you can sit in a stillness and quiet. Present and aware. One more breath here. And making your way up. And all your way down onto your back now. So take your pillow to go under your knees. So this is our Shavasana, our resting pose. Or if you like, as an alternative, maybe you have a wall nearby, you could go and take legs up the wall. Legs up the wall is the same shape as downward facing dog. The relationship to the earth is just different. So we're still in flexion here. We're in a forward bend position, but the weight of the legs is going to come down nicely into those the hip sockets and creating a nice supported stretch for the lower back while also allowing it to relax. So you may have your legs up the wall, Viparita Karani, or Shavasana. Making any adjustments that you need to make now, and then committing to finding stillness in the posture. Consciously releasing any peripheral tension. And one way that I find really helpful to do this is to use the image of my exhalation, inviting the sensation of letting go
As you exhale, allowing the tension to drip away from you. Inviting a sensation of heaviness into the body. Feeling the density and the earth quality of your body descending down to the ground beneath you. And if you're in legs up the wall, go and draw your knees in and roll over to one side. If you're in Shavasana, bend your knees and do the same, rolling to your side. Very slowly, coming up to sit. You can take your pillow to elevate your hips as you find any comfortable seated position on the floor. And bring your hands to your heart. To close, I invite you to join me in the chant of Om. But before we do that, just checking in once again with your lower back, bringing your full attention to the areas where you have tenderness or where you've experienced pain in the past maybe. And speak silently to yourself, I am listening. And then we'll take a chant of Om, directing the vibration right down to the base of your spine, to your sacrum, the pelvis. Imagining that that sound vibration could bring a sense of ease to all the muscles and ligaments there. So full breath, inhale to exhale first. Nice big long exhalation. And then we'll inhale for an Om, sending that breath right to your sacrum. Namaste, yogis. Have a blessed day.